So, as I was looking for technology also to make a difference in my clients' lives, there's a few talking points that go on. I approach it, what we call our care and safety program. I approach it from a care management position. I don't really focus when talking with referral sources just on the high alerts, but I basically make a whole centered approach to the client. And so, what I would say is that what's most important when you are receiving some referrals from, various sources is obviously the quality of the care and obviously the compatibility of the caregiver. So one of the things that I always talk about with our referral sources is the fact that now with Sensi, I can prove that the client and the caregiver are compatible. And if they're not, I can make a change sooner than later. So that is something that, really is a differentiator. And it's because of the data that we receive. I try to, just really bring it to, for instance, a hospital's level. What is case management in hospital looking for? Well, they're looking to ask them what their goals are, to reduce readmission rates. We can all get the readmissions rate on Medicare.gov. And then I just speak to them that obviously, I share with them, I approach it with some care. We do case studies. Here's a client, here's their care plans from Sensi, because you initially you do a face-to-face assessment, and then now you have that plus the Sensi. And instead of waiting for that next visit, whether it would be in a month, in 2 weeks, in a week from a supervisor, now you have real-time information coming in that you can make updates and changes and identify, like I said, any issues that might be happening, whether it be a training issue or a compatibility issue. So I think that is something that certainly you should definitely, use when talking with referral sources. I can't say enough. I just had a luncheon yesterday, and really we don't call them luncheons, it's just like a little round table. And everybody's always really interested in the technology. But if you just focus on bringing it to the fact that the clients now, when they're discharged, can now be afforded 24-hour care with a caregiver and then Sensi. So whether they have 8 hours of care with Sensi and the caregiver, they're getting 24 hours care. If they have 4 hours of care, I decided, I guess about a month in, to give Sensi to all my clients, even if they were running less than 20 hours a week, because they are the clients that are at the most risk when I took a look at my readmission rates and I took a look at falls in the home. So, one of the things I would suggest is, to think about that. And those are the clients where we've seen the most growth. Those with less hours, obviously, as far as hours go, they're staying with us longer and they're growing with us because now we're able to detect exactly what they need. Not just suggest it, but now we have data to back that up. So I think that's really, really important, and to take that whole person approach. And obviously our caregivers like Sensi. I get that question a lot. They like it. They think it's great because, I haven't had one caregiver say, they were uncomfortable with it. They think it's great. It's almost like a layer of, protection for them while they're in the home too. So I'm just here to ensure that the client's goals are met, that they can stay at home as long as they want. And of course, budget comes into play with that. And so what we've been also able to do is have those discussions with families about their budget and ensure that they can stay at home longer, which of course, for anybody in the home care industry, leads to retention. That means they're not going into the assisted living facility. Maybe that would have been the choice without Sensi, because now we're offering them that 24/7 care in their home. So that's kind of where I go with it is a case management system, and we're able to detect earlier the cognitive and physical decline. We're able to interact earlier. And, it does lead to growth in hours, but more importantly, it leads to that satisfaction of that family. And then, yes, word of mouth definitely has grown. And I agree, my hours, percentage wise with my clients who have Sensi, I agree with Bruce, they have grown quicker than my hours without.